This video will help you to understand the following: the different factors that can impact a person's ability to eat well, what happens when someone loses weight without meaning to, and the consequences that can occur when someone starts to lose weight and becomes malnourished. There's a wide variety of reasons why someone might not be eating and drinking enough. These factors can affect older people in many different ways and can explain some of the problems experienced whilst trying to access food. They can also explain why someone might lose interest in eating. Problems with mobility can affect a person's access to food in a variety of ways. How do people get to the shops or supermarket? Is there public transport? Living in a rural area can restrict getting out and about to local shops, and poor transport links can make travelling to buy food an unpleasant and expensive experience. Sometimes the only option may be small corner shops with a much reduced selection. If public transport is available, buses can be challenging to use, and large supermarkets can be daunting too. And this is before we have even thought about carrying heavy bags home. Normal, everyday things such as cooking can become hard to do as we age. Standing for a long period of time to prepare food and using utensils such as knives or peelers or opening packaging can become more difficult. Social isolation and feelings of loneliness can have an impact on how we enjoy food. It's probably become more normal for families to be based further away from each other, and the old support systems of the past are becoming weaker, leaving more older people feeling much more alone. Bereavement can also play a large part. The loss of a long-term partner, and also amongst close friends, can be the cause of depression, leading to a lack of interest in food, and in some cases, this can leave people without the skills needed to cook for themselves. Whilst depression can lead to a lack of appetite, it can also affect motivation. Making convenience foods such as sandwiches or tea and biscuits can be much more appealing than having to prepare a meal from scratch. Issues around memory, such as dementia, can result in forgetting to eat and experiencing changes in tastes and smells. Have you noticed a difference in what someone you see regularly is choosing to eat? Do they prefer more sweets or sweeter foods in general? Have you noticed that they are having problems recognising when they are hungry, thirsty or full? These can be signs that they may need extra support to eat well. Ageing may come with many different chronic diseases, with the resultant medications prescribed potentially influencing how and what someone eats or drinks. Older people can experience changes around swallowing, perhaps from a stroke or Parkinson's disease, which requires changing the texture of what they are able to eat or drink. Problems with chewing food due to issues with dentures rubbing or dental problems can affect someone's ability and enjoyment to eat. Financial pressures can have a big impact on how much we spend on food, with many older people having to choose between paying for heating and buying healthy foods.
So underweight malnutrition is actually quite prevalent, particularly in older people or people with other health conditions, and the consequences can be very significant. So for example, if somebody is underweight, they can find it much harder to fight off infections, and also they can find it much more difficult to respond to treatment for other diseases, for example things like chemotherapy. They can also find that wounds take much longer to heal and are more likely to be infected. So this can affect mobility because it can increase their pain and it can increase general discomfort. And it can be really quite distressing for patients as well. And this can sometimes also lead into secondary consequences. So we can find that, for example, if you're in pain and you're lying in bed because you can't walk as much because you're unwell, then you also might then become constipated, which also might cause you more discomfort. It might also make you feel full. It can affect your appetite, so then you eat less, so it gets worse. Again, if you're lying down, you're not well, there's pressure on your skin. Again, we've just said you're probably not very hungry, you're eating less, so eating less and less and getting less and less nourishment and more pressure on your skin puts you at risk of pressure sores, which again can become infected. And you can end up with a spiral of all kinds of different consequences from actually just not quite eating enough at the beginning. It can really become something else. There's short and long-term impact. It can affect mobility in the short term, as I said, but it can also lead to longer-term mobility problems if somebody becomes really deconditioned from that prolonged illness period. It can also mean that they can be in hospital for longer. If they're not in hospital, it can mean that they are admitted or more likely to be admitted for an illness that they otherwise might have managed to remain at home with. It can mean that they see their GP more because they get more general ailments that become significant enough to need help. As I say, the immune system is affected, so something that might be quite minor for somebody in a more robust nutritional state could actually be quite debilitating. And this can all mean that the quality of life of the person is affected. So they can't do all the things they wanted to do, which could mean anything from not being able to go to the kitchen to make a snack, not being able to walk around their garden and enjoy the birds, not being able to go out with their families. It can be really quite significant. And of course, all of these things again feed in to make the problem worse, because then when you're feeling quite low and you're not very active, you're not feeling very hungry, and again it can spiral. Sometimes people think, oh, we'll just wait and see, we'll catch it later on if it gets bad enough. The problem with that is it can be much more difficult to regain weight than it can to maintain weight. So if somebody loses a little bit but their weight is still okay, catch it then, keep them stable is generally much more achievable than waiting till somebody's massively underweight and trying to pull them back.
Often it's thought that losing weight is a natural consequence of getting older. This is definitely not the case. No matter what causes a person's weight loss, it's important to recognise the signs early on so that they can get the support that they need.